There's a lot we don't know about opioids, but there's one thing we know with certainty, and that is that, more than most other types of medications, opioids will require you to be an active, observant, and vocal participant in your own course of treatment. Opioid therapy isn't a one-time decision. It's an ongoing process that requires continuous monitoring and adjustment, and regular contact between you and your healthcare provider. In a sense, that means you'll have to be aware every day of what feels right, what feels wrong, and what you think you need to change. You can't be a passive bystander. You have to take charge of your treatment and take charge of your life. If opioid therapy works, it's because you're working with it. If it doesn't, you need to accept that and begin to explore other treatment options. Most important of all, you need to know that you're not alone. Whether the therapy is working or not working, whether you need to adjust it or add to it or scrap it and try something else, your healthcare provider is a constant partner and guide who's willing to listen and help without keeping score or passing judgment.
There are many things that we take into consideration when determining the appropriateness of prescribing narcotics to individuals with pain. The first thing we consider is what is the origin of their pain, or what is the process that's causing their pain. The second is what other conditions do they have that may be contributing to or may provide an obstacle in treating that pain. Narcotics are very effective for alleviating some types of pain, but certainly not all types of pain.
Opioids do not work for everyone. They do help a lot of people, but there's a large percentage of patients that don't respond to opioid pain medications. One is they may have a side effect that they can't tolerate. We know about 50% of people that take opioid pain medications have at least one side effect, and about 20 to 30% of people will stop taking opioids because of the side effects. So they're not for everyone.
Well, I think it's the whole part of managing a patient with medications. It's like any kind of disease process, whether it's insulin control for diabetes or blood pressure medications for hypertension. You have to just have a close follow-up with the patient. I think you have to have a good discussion with the patient on what are their goals for this. Is the medicine going to help them sleep? Is it going to help them with their pain? And so again, it is definitely breaking down the goals with the patient. And I like to break it down into the pain-reducing effect of the medicine, the effect on their mood, and then their effect on sleep. And use those three areas and then adjust what the patient's going to need.
Are there certain medical conditions that you have that may make you more at risk for taking opioids? Are you older? And the side effects of opioids, such as drowsiness or the inability to think clearly, you may be at higher risk if you're older.
Opioids are dangerous drugs. They need to be used under a doctor's prescription. For instance, if someone has a sleep apnea disorder, I'd be much less inclined to prescribe higher doses of opioids because of potential for worsening their respiratory problems.
The main goal in using opioids is to reduce someone's pain so that they can return to near normal function or to improve their quality of life.
I often, actually in front of patients, will do this as if it's a scale. And so if I give you an opioid, am I making your life better or am I making it worse? It actually is that simple.